and she wrote a doctor, and they called me out when there was an emergency in flight, and I don't like that. So
What? I wish I was there. Okay, so you had
yeah.
there was a patient in the flight.
In the flight that needed some urgent attention because otherwise they have to find a emergency landing. And it was a long flight, so you don't want to land in the middle of nowhere.
Yes.
That time actually there was a war in Syria. They were telling us we're flying over that country, and you don't want things like that.
I'm glad you're willing to help. I'm sure you're very willing to help. So
Well, I did help, but yeah, the title though.
I see.
The risk factors. First, being a male just puts you at a risk. So all of us being male are at risk. So, and then the second thing, black male have higher incidence of developing the prostate cancer than other counterparts.
Yeah.
So, yep.
Okay.
Okay.
So you want to put your finger behind.
Well,
Kamoxozo.
Gamoxazone, that's right. Ntho tse re di etsang as doctors di ngata. I mean, it's a human body. We need to be able to access it anywhere. So that's one of those. Yes. Kenya exhaust, the finger in the exhaust.
How many men have you done this year, Phil? Baba, do you imagine like, I'm curious.
Okay, let me tell you. Not the right thing, but I also don't like doing it.
Okay.
Yeah.
But-
So as a result, and for this one reason, let me tell you this something I read. Actually, it was also all over the newspapers.
Okay.
Some guy went to the doctor and had the same examination done on him. The doctor needed to do the digital rectal exam, and then upon doing it, because it's a sensitive organ, this prostate, it caused the man to ejaculate. Yeah. The man was so embarrassed. The man was so embarrassed, was so angry as well because he thought he was being molested.
How?
He went home, he fetched his gun and came back and shot dead the doctor.
Oh no. Oh no.
So for that reason, it's not a test that you want, and you have to explain, of course, to the patient, but you don't want to do it. The patients must know we don't like doing it, but we must do it, especially if there's a reason to do it.
Greetings, ladies and gentlemen, and welcome to Palabora Podcast Corner. My name is Nico Mabaso. We're filming from Sfapane Lodge and Palabora. I'm always happy and delighted to be here. It makes my life easier. Please don't forget to like, comment, and subscribe on our YouTube channel. And social media, we are Palabora Podcast Corner. On YouTube, we are Palabora Podcast Corner. Please jump in there as you are watching. Please like. You're also welcome to comment, say something about this episode if you loved it. Or even if you didn't, just say something. We'd really appreciate that. At October in South Africa, I don't know if it's the rest of the world, but it happens to be Cancer Awareness Month. And we thought, why not sit with someone who's a professional that can, give us an idea on what this thing is about, because it's a monster in the community. So it's very important that people should know about it. Without any waste of time, let me welcome our honorable, someone very significant in Palavora and also the rest of the world, because it's probably not new. Let's welcome Dr. Motsoane.
Yeah.
It's a very, this name is not common. Welcome to Palavora Podcast.
Thank you very much, Nico. Thank you for having me. Yeah.
Look, Kabo Munje, today I just want to enjoy calling you Bratabo.
Please do. Please do. You're welcome. Actually, why not? Let's be relaxed.
Yeah.
It also makes me feel
comfortable.
like comfortable and relaxed. Yeah. So let's do that.
No,
When you carry the title, usually I say to people, I like and carry that title in my office.
Okay.
Outside of that, I don't want people to be calling me doctor.
Yes.
And even my wife at some point, I told her she booked a flight for me, ne? And she wrote a doctor, and they called me out when there was an emergency in flight, and I don't like that. So,
What? I wish I
so
was there. Okay. So you had
yeah,
there was a patient in the flight.
in the flight that needed some urgent attention because otherwise they have to find a emergency landing. And it was a long flight, so you don't want to land in the middle of nowhere.
Yes.
That time actually there was war in Syria, and they were telling us we're flying over that country,
Ay, ay, ay.
and you don't want things like that.
I'm glad you're willing to help. I'm sure you're very willing to help. So
Well, I did help, but yeah, ish the title though.
I see.
Yeah, but yeah, I'm happy with
It
travel.
works. Ne?
Mm.
Okay.
Yeah.
Oh, now it's easy for them to know there's a doctor in the plane.
No, let me tell you something actually.
Mm,
They gave me 2 bottles of very good wines
mm.
as an incentive or reward for that.
Mhm.
Well, I would have liked maybe an upgrade to a first what's that thing? A first class.
First class.
But I didn't get that. I got the bottles. And then they took them at the customs, the next airport we got to. I
Mm.
was so upset. 'Cause I didn't even taste a
Did-
single one.
so they didn't allow you to go through with them where you were
Yeah, so
going.
we were connecting at
Mm,
this Frankfurt airport.
mm.
So when we move from one end to another, they don't allow you into the other end. So
Oh, and you
shame.
didn't know.
And I didn't know. I was so excited because we were planning. We were going to Canada, and we were planning when we get there, we're gonna have fun with our bottles. But no, it didn't happen. And they
Oh.
don't allow you to drink quickly there. So I was like,
In any case, no see enjoy.
I guess.
Otherwise, but thank you for joining us on
Thank
Palavra
you.
Podcast
Thank
Corner.
you.
You're a very busy man. Leboha o dirile nako just to come and share knowledge with
Mm,
us and our viewers at home.
mhm.
Just before I go straight into our topic, uh, Bomutshwane, helege theta le reng.
Yo. Wa thoma jwang? Well, my mother, if I tla bona taba e, o tla ba embarrassed a little bit, but she didn't teach me much of it. But re ko botse, nna I was born ko Gauteng ko Thokoza, ko township. So tse tsa go reta tse ke tsa lona tsa the village, the cultural more stuff. I didn't have that upbringing.
Okay.
But mo wa ka ha e reta yena o tswa ko le Lesotho yena. A re yena ke wa Mokoena, ke wa Mofokeng hape, and so she goes on and
Yeah.
goes on. I don't know the rest of it.
No,
So
it's okay.
sorry.
It's allowed. I understand.
Eh,
Tell you what, Lina, I'm not sure of my story, so
yeah.
I wouldn't judge you.
Yeah, thank you. Yeah,
Where
no,
did you do
I
your
missed
maths?
that class.
Where did you study your maths?
So, university, I went to Wits University,
Mhm,
but I was coming from the same township, go Buhlebuzile High School.
mhm.
Before that, I went to Haung Primary School. So I spent really that first part of my life go in the same area. Haung and Buhlebuzile were in the same township,
Thokoza.
Tokoza, and then Wits was just a few kilometers away.
Mm,
So I was close to home all the time. That's
mm.
why now
So it
here.
made sense to go to vet.
Yes.
Is that
No,
what
well,
was it because it's closer or
no,
you
no, actually.
you always
V-
wanted to go there?
Vets was a status thing, hey? Even
Ah.
to this day, I'm told it's a status thing. Vets, UCT, and UP,
Mm,
University of Pretoria,
mm.
I think they're competing for the first top posts, and Vets and University of Cape Town, the compete on that. So it was a status thing because I always wanted to work overseas, and my reason for going to Canada actually was to survey the environment, working environment, so we can put in applications and stuff like that. So I knew if I had a vast degree, I can go anywhere in the world and work and do anything.
Mm.
Plus, also there was always this thing, yaore, I did tshwane di-degree tse ha di na weight ya ho lekana.
Okay.
So I wanted that one heavy so that I
Mm.
can, you if you go to any corporate or anywhere you want to go, you have the heavy thing and then people will let you through easily.
Okay.
But I must also say this. It was closest to home
Okay.
also.
Mm.
If Cape Town was closer to home, I would have gone there.
Mm.
But this one was closest to home. And the reason I needed to be close to home, and re tswa mo le mo dikobong re senang a lot of resources ko
Okay.
ntlong. So no tshaba hore if o ka felelwa ke everything mid-month or anywhere, and you have to go home. You
Mm.
don't want to be hustling or looking for a lot of cash to get home. So you wanted
Mhm.
to o ka hlaba terene da or
Mm.
taxi nyana, you'll be fine, you'll be
Quickly get.
there. Yeah,
Okay.
that was my main reason.
Look, it doesn't matter.
Mm.
Okusalayo uyidokotela.
Yeah, in
That's a vet,
ultimately.
not just yeah, vet.
Yeah, yeah.
Yeah, of course. No.
Makathaba hambe batho ba ka Wits, utlwa that part.
No, look, I've got friends. I've got a friend of mine, very close friend of mine, my colleague, in fact, who did his masters at vets. He's very proud of that
Yeah,
institution.
yeah,
He
yeah,
makes sure
yeah.
that he makes you aware that no, it's not just the masters
Yeah.
from vets.
Yeah, absolutely. But it gives you the edge.
It does. It does. No,
And it
I'll
did
give it.
give a lot of people the edge,
Mm.
even me.
Yeah, no, no, no. It's allowed. I understand. You
Yeah.
deserve it. We'll give you your flowers.
Thank
Yeah, you deserve it. Look, I want us to get straight to topic. Why did we call you here?
you. Mhm.
Because ke tlhoba boroko ka Sepedi. It's this thing is a monster and it's taking a lot of family members, friends, colleagues, you name it. Um, and like, what is cancer? Please tell us, make us understand. These medical terms can be very confusing to us ordinary people. Cancer gang and like,
All right. Cancer, it's a well, let me start two steps back. When generally when you are born, when you are made,
mm,
you are a cell that develops into becoming a human being that you are, and that cell evolves or develops certain parts and becomes a leg, a head, eye, this and that, and then and each one of those organs is composed of cells that make it whatever it is, that organ. So cancer, it's when at some point, whether at birth or even anywhere in your life, in one of those cells that make you up becomes abnormal, starts to growing as if it's like a parasite or a person or something in you that is abnormal and tends to usually eat you up and then causes a lot of health problems. As you can imagine, just take for an example the muscle. If you develop a cancer of the muscle doesn't work in the way that we know it should be working. It becomes erratic and it starts eating you up. Starts taking all your resources that you usually used for your day to day activity. So that's what, in a simple terms, a cancer is just
mm,
an abnormal cell in the body that is grown from a normal cell and now becomes its own thing.
hmm, I see. I've never had it like that. I'm sure I'm not the only one.
Yeah.
What causes cancer and like what? Maybe to make it easier for our viewers, let's start with the common ones. In your experience, in your line of work, um, which ones are common? Because I understand there's a couple of like the way you're explaining it. What are the cancer tsa ho fapana?
Ke nnete.
Ke dife tse di leng common that you normally encounter ha o le ofising?
Right. In my line of work, especially here in Palabra, the commonest cancer that we do see is cervical cancer. In fact, in South African context, that's the most commonest cancer. Around the world, there's different types of cancers. Also, some of them are regional. They're dependent on which part of the country you're coming from or what exposures in terms of some people who have worked in a gold mine, they'll be exposed to a different type of cancer and people who've been exposed to asbestosis, in the 80s,
Mm,
and they will be exposed to that type of cancer, yeah, at the lungs. And then people who've worked in radiation environment, they will be exposed to different type of cancer. So it can be also regional. And so from one country to another, it may vary which one is more commonest. In my line of work, I see more cervical cancer. There's also the one actually that we are celebrating this month. Actually, I wanted to say to add to what you said in your intro there that this is you're not sure if this is a breast cancer awareness for South Africa only or not. It's actually a worldwide program that was initially started in America by Americans in in the mid 80s or so to
mm,
start celebrating or putting a spotlight on some cancers.
mm,
And so we've got a medical calendar, and this specific month, October, a spotlight is being shown on specifically breast cancer, November being prostate cancer. So that as I was saying, breast cancer is one of the more common ones as well. But fortunately, with the late advancement and our understanding of the cancer as well,
Mm.
things have changed since the time many years ago when we first knew about these things.
Wow, I see. So you are saying what the cancer in common, and it's cervical cancer
Cervical, yes.
and lung cancer
Cervical cancer and breast cancer.
or breast cancer.
Yes.
Okay, most of your patients by cancer that you or in the country that you're dealing with, it's either cervical or breast cancer.
Yes. And so and the another thing I just need
Mm.
to qualify is that
Yes,
um, cervical cancer and breast cancer in particular, they mostly affect women. So this is
yes,
a most commonest cancers in women.
yes.
So and then but if you look at WHO, which is World Health Organization, according to their international grades,
Mm,
we find what the breast cancer leads. Although in our South African context we have cervical cancer that leads
mm,
the charts, and then and that is in women, but
mm,
both in men and female, and male and female, you get your breast cancer being top of the list around the world. But if you come to South Africa, you get cervical cancer, and then
even
in
men.
male, yes, male can get both. No, not both, but they can get breast cancer. But that's 1% of all
Oh,
people with cancer.
this is new
Very
to me.
rare. It's very rare, but it's there.
Okay,
Mm.
okay. So with men, because with women, I know that when you identify breast cancer, they nalo kgaola letswele. So ga banna, what do you do?
Same, really. The treatment is the same. So in male, as I said, is very rare. About only 1% of all people that have cancer, breast cancer, they're male. So in male, how you'd identify it and how they become also at high risk is being coming from families that have some type of cancer. So that
Mm,
makes them at high risk of developing one, and that the diagnosis is also the same. You find a mass or you find something that's abnormal in your chest, in your lung, in your breast.
mm,
Then we go test it in the lab, and then we find that or even in the X-rays we find there's abnormal cells. Then we take it out. Fortunately, as you know, most men don't have large breasts, but
mm,
although there will be those guys that will have large breasts, they if they we take it out the whole thing, we take it out. But for them, it doesn't have the same impact as female because you can imagine with female, we're used to having them
mm,
with large bosoms. So
mm,
if men don't have bosoms, it's okay. In fact, for some of them, they feel like it's a good thing because then we get to cut away the stuff that most men don't like.
mm,
Mm.
mm. I see. Ooh, okay. I I know a couple of women. Some of I had a relative. She had cervical cancer, and unfortunately, she 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 she, she passed away. How? Let's talk about the symptoms of cervical cancer. We'll go to. Of course, I also understand that with us men, the common one, prostate cancer. Let's first talk about the cervical cancer. What are the symptoms? How can someone know from the onset, maybe at an early stage? How do you identify it yourself before you could even come and visit you?
Right. Cervical cancer, just to put it also into context, it's a cancer that affects the cervix, which is it loosely re bitsa molomo wa popelo.
Mm,
It's at the tip of the cervix, the internal lining. There's an area which we call transitional area, where if you start developing cancer, it will show there. So, um, how you get it to begin with is usually you get exposed to a human papilloma virus, which is what the government has gone out to give vaccines to people in between ages of 9 and 11 years before they become sexually active. So you'll see the standard twos, or what do you call the grades now? Grade fours and
Grade 4,
yeah,
yes.
grade fours there. They will get vaccinated at schools these days in
Mm,
South Africa. Um, and then that usually is to prevent if you get exposed to that. So once you get sexually active as as a female, you if you get in contact with HPV subtypes 16 and subtypes 18, those are the ones that are dangerous that can cause you to ultimately develop into cervical cancer. Now the thing about this is that also the risk factor there is sexual activity and multiple partners as well.
mm,
So if you have one partner, generally it's not a big problem. But if you've had multiple sexual partners, to a higher risk of developing this cervical cancer. Now, the thing about the cervical cancer, it takes about up to 15 years to fully develop. So we people don't usually know when they have it. So it's difficult at the early stages to figure it out or just have a symptoms. There's no usually symptoms. But when they are there, the first thing people will start having abnormal bleeding, vaginal bleeding. They will start having discomfort. They start having pains, especially during intercourse and things like that. And then, however, these days we have got screening tools like pap smear that we do use to look out for it. So we say any woman who is sexually active can start looking out for cervical cancer, and even more so if they've been predisposed to the things that I mentioned already.
Mm.
And then we look when we find it. We usually with pap smear we look for signs if it's going to be there. If there's any at that area I mentioned earlier, transitional zone, if we find any abnormal cells there, we tend to take out a bigger sample to test it in a lab to make sure if it's not cancer. And if it is cancer, we usually will advise the woman to have the whole thing removed, including sometimes the uterus, the womb.
Mm.
So the woman generally they take long to to have symptoms. As I said, it takes about 15 years to be fully developed. You would be exposed at the age of 15 years and only around, and sometimes a woman will be maybe at 15 years will be sexually active and stop, and then think start living a normal life and not expect that they will have this later on after 15 years from that initial exposure. Then they have this problem. So that's why we encourage that any woman who's ever been sexually active to just continuously do the screen. But usually after the ages of 65, if you've never had anything, the risk is close to zero.
Oh.
Yeah.
Oh, okay. Or if you're 65 and above, the risks
The
do are.
risk tends to be zero.
Mm.
The assumption there is that not that you cannot, you shouldn't.
Mm.
You can still go on and still test, but your risk is less compared to a sexually active woman. So
Mm.
in a lot of cases, we find that women's sexual health ceases around the ages of 60 and above.
Mm.
So there is no, a lot of them are not getting exposed to all different types of these HPVs,
Mm.
which later on causes HPV cervical cancer.
So the HPV,
Mhm.
is it a virus?
It's a virus, yes.
Is it possible to get it from your spouse, even if let's say your spouse is having multiple sexual partners, and then but at home the wife only has intercourse with the husband? Is it possible the husband to bring it home?
Yes. So HPV is a generally a sexually transmitted virus.
Okay.
So if a person, and that's why this disease is more around being sexually active. So the promiscuous husband tends to bring the virus at home to the woman. And remember, it mostly affects women,
Mm.
although it can affect men, but it mostly affects the women.
Mm.
So the woman can develop the virus over a period of years and have it. So if they say, for instance, a man, and that's why I say the risk is close to zero. Say a man is in his 70s
Mm.
and he's got a woman who's still young at 60. He sleeps around elsewhere and comes to bring it home.
Mm.
The woman later on can pretty much have it.
Mm.
Although our life expectancy in South Africa is around in the 60s there, so a lot of times it's missed because either something or the other happens and then it's the woman dies.
Mm.
And but the people who are more younger, that's where we see this problem a lot.
So generally, you're saying that the cause, or let me put it like this, is the only cause cervical cancer. Are you saying it's sexual transmitted disease?
Yeah, it's a HPV, cervical cancer.
Mm.
It's generally a sexually transmitted cancer
Okay.
through HPV virus. So we it's hardly ever, although in nothing in absolute in medicine, it's hardly ever you'll find some people coming up with cervical cancer if they've never been sexually active. I've not actually come across that, but I'm more than willing to accept if there was a case or there is a case out.
This is very important information. I didn't know. Okay, maybe it's because I'm not a woman. And this one particular, yeah, yeah, I don't know.
Mm.
Okay, but it's fine. Thank you so much. This is very informative. Now, Um, let's quickly jump. Okay. Then the treatment, ya gona, how do you treat it when you now find out someone is 35 and you run all those tests, you find that they test positive? What how bophelo bo change bjang from an ordinary person o na ke phelela? So normally what is go changing?
Haholo-holo the main thing e tjhentjhang ke your ability to bear children as a woman. So when we first find it, we screen first if whether it's spread to other parts of the body. So we'll do cancer screening or cancer staging, which will put you whether a stage between stage 1 and 4. Where stage 4 is spread just about everywhere in the body. Stage 1 is limited only to the cervix, and stage 2 is just adjacent areas, and stage 3 it's just above two body regions. So um, if it's still within cervix alone, we tend to remove the cervix, and the cervix usually goes with the womb. So we tend to remove all of that, and thereafter, a woman will not be able to have kids. So if you still had ambitions as a woman and you want to have kids, and that part of it is totally out, so you will not be able to have kids thereafter. Of course, if it's in higher stages, we can't remove it if this, because now after we have found the after we have staged you, we send you to oncologists who will plan your the way forward in terms of treatment, because there's different treatment modalities. First one is surgery if it's limited to one's area. Second one is radiation that they can burn surrounding areas if also they find that they are testing positive for the cancer. And there's also chemical chemotherapy, the chemical way of treating it. So which where people take a certain medication that tends to treat it with wherever it is in the body. And a lot of oncologists tend to use both methods if they use if there is room for because one of the things that they do if it's stage 4 and it's all over the body, your quality of life has already deteriorated and there's other multiple medical problems that you have on board. It tends to be much more difficult to treat it. So what we tend to do is the guys will tend to focus only one aspect, maybe chemotherapy or maybe radiation only, and see what happens. But they tend to the oncologists they will make their determination because one case differs from the other always. So they treat each case according to its own merit. But these are the treatment modalities that exist, and it tends to always affect the quality of life. And a lot of other thing that I must say, people with HIV in particular, because it's a very common medical condition in South Africa, tend to have it worse. So they tend to if you have a cervical cancer and you have HIV, your odds are slim as really. So and the chances are that you've already have it spread to different body parts. So your quality of life is already
Mm,
low, and your it's your life nje, it has already changed when you just make those discoveries that you have this and you have that, and life is no longer the same really.
mm, I see. Okay. Fine. Let's move right along. Let's quickly jump into um the yaban just to get a balance.
Mhm.
Prostate cancer.
Mhm.
You've mentioned what is cancer, etomaviang, and all that. Let's talk about prostate cancer because it's totally different from a the one is a tshwenyang batho ba bomme. What are the common symptoms to prostate cancer?
Right. I must also qualify for prostate, well, also identify it because, we work by definitions in
Yes.
medicine. So, prostate cancer, as you say, is a cancer that affects the prostate. Only male have it.
Mm,
So, it only affects male. And it's the most common cancer in the male category.
mm,
And the risk increases when you are starting from the ages of 50 on. There's a literature I read that it says one, your chances of developing prostate cancer they increase by 1% from every year from the ages of 50. Now, WHO has it that one in every 15 men will develop prostate cancer. So that's a very high
mm,
chance of developing this prostate cancer. Now, um, now the prostate is a gland that is sitting just below the bladder, and as, just on at the bladder level, you get your urine pipe that goes through the prostate, and connects with some vessels that come from the testes, and that causes that as your semen that
mm,
makes ejaculation. Now, when you have a prostate cancer, naturally, as it grows this organ just where these things are, it's going to affect those two things that I mentioned. It's going to affect your your ability to pass urine. So the first thing men will say when they start having the symptoms, they'll say, I am I'm going to the toilet a lot more often. And the reason is this thing constricts the urine pipe. And then as a result, you cannot empty your bladder fully. You only can empty what you can because you need lots of pressures to empty that bladder. So once you've passed that pressure level, you don't feel the need to void. So you will go back home or to continue with your normal activity. Thereafter, you still have a age to go and back and many times. So uh, the first symptom is urine frequency. So you'll be passing urine a lot. Urine stream decreases as well. So you will not, when you are young, we used
mm,
to play games with other young boys
mm,
who can shoot the urine the fairest.
mm,
And when you are having prostate cancer, you can't go that far anymore. It goes usually. The professor that had taught me at university said if you cannot pass, if when you urinate, your urine cannot go further than your feet, that's something to worry about there. You need to always be shooting far away.
mm,
So that's one of the things that you have. Sometimes we say we know some men come with blood in their urine. If you start seeing signs like blood, you need to start getting worried about it. If you start seeing ejaculation or semen with um, blood in it, you need to start worrying about things like that. And discomfort and pain in the area of the pelvis also can allude to you having prostate. So those are the signs that generally men come to us with when they do have some type of prostate. And there's another condition which can be confused with prostate cancer. Sometimes you can have inflammation or swelling of the prostate, not because it's got cancer, but it just swells up for many other reasons.
mm.
And that's called prostate hyperplasia, benign prostate hyperplasia. So that is not breast cancer, but it gives similar symptoms. But we don't want you to think that it may not be cancer. We just always want to check when you have prostate related problems.
Mm. Okay. Scary as it may, we need to talk about it.
Yes, we must.
We need to talk about it. And the rumor says, but it's true.
Mm-hmm.
Banna ba kon lo ya sepetlele.
Neat.
Men don't normally go to the doctor or to clinic or hospital. Men don't like it. General. Look, bona monna ilo consult, it's bad.
Mm-hmm. Neat.
And it's not a good habit. So as a man, how often should one come and see you just to monitor? Because you've mentioned issue ya hore, um, when you're 50 and above, the chances are growing tja hore o ka ba le prostate cancer. How often should a man check for these things just to be safe?
Yeah. So I want to first highlight the risk factors.
Mm,
First, being a male just puts you at a risk. So all of us being male are at risk. So and then the second thing, black male have higher incidence of developing the prostate cancer than other counterparts.
yeah.
So yep. So if you're
You'll
black,
tell me why.
well, I wish I knew.
What?
No,
How what?
I
That's
don't know what
unfair.
something in the black genes black men at higher risk of developing prostate cancer than all the other
Okay.
races.
Okay.
So that's one, and then the age as well is the second thing. So you mentioned correctly from the ages of 50.
Mm.
But if your direct relatives or blood families have got cancer, your risk starts at a much earlier age, like 40 years. We start screening, we start looking for
It
it.
doesn't matter which cancer.
It's specifically prostate.
Oh,
Yeah.
okay.
So we,
No, I'm saying if my on my bloodline, if let's say my dad died of cancer, does it have to be prostate cancer to be worried, or even if nanali breast cancer?
okay.
Mm,
Yes. Good question you've asked. No, no, and yes.
mm,
And here's why it's a yes.
mm,
When you have cancers like breast cancer
mm,
in females in your family,
mm,
can also put you at a high risk of developing prostate cancer in the
mm.
lineage. But generally speaking, and this is the no part. Generally speaking, you have a high risk of developing the same cancer than what the person who's died
Oh,
of. It's not always give and take that
okay.
if you have had a bone cancer,
Mm,
everybody in that same lineage will have like bone cancer.
mm,
But your risk of developing as well are high because these things run in the genes.
mm.
So that's a no and yes of the
Okay.
answer to your question.
Oh, okay. I
So
see.
don't if somebody has died for, I mean, say colorectal cancer for this,
Mm.
for another example, it doesn't mean that you must start worrying about your prostate cancer. You worry about the same cancer that
Oh,
they died of first.
okay.
But if there's a relationship, like the breast cancer has some type of relationship with prostate,
Mm.
that is the one that you can start looking also.
Okay. Bratawo.
Hmm.
Now, as you are unpacking it like that, ke tla like okay, let's say, for example, for someone who died of lung cancer because they've been smoking the entire life,
Mhm.
um, does that mean or this person he was gonna have cancer anyway, whether he was smoking or not? And before you answer, if no, it was caused by him smoking a lot, does also put me in that risk, yeah, the same cancer, or yeah, it caused by smoking.
Explain that last part.
Okay. I get it. Let's say my dad was smoking a lot.
Mhm.
Smoked from the age of 15 until he was 70.
Mhm.
And then he was diagnosed with lung cancer.
Mhm.
Does that make me put me into the same riskier lung cancer as the son?
So passive smoking, does it lead to high incidence of cancer?
Mm,
The answer again is yes and no, and I'll tell you
okay.
why. Um, we have the literature has it now, and evidence as well has it that you don't not all smokers will develop lung cancer.
Oh,
So
okay.
it's not, although smoking can cause cancer, you'll see these
Yes.
notices that they
Mm,
put.
it
It
says
says
can.
can,
It doesn't
doesn't
say will.
will. And the reason is simple, is that not everybody that smokes will develop cancer.
Mm.
But if you are at high risk of developing cancer, you will develop it much faster, much more aggressively from smoking. So
Oh.
even for passive smoker, the same risk applies.
Mm,
There's some literature out there that says the passive smoking increases your risk of other things or lung-related
mm,
problems than the person who smokes. Well, that's there, but it also it leads to that it's always about a risk that you carry within your genes. Unfortunately, genetic studies are much more complex. We never know what
mm,
you are at risk for, and there's movies actually that you may have seen where when you are born, they do a genetic profile. You do your genetic profile, see what are you going to have in later in life, and if they can find a solution, they will give it to you on the spot. Blah blah blah, which is a fancy thing, and if it happens, we'll be happy. But unfortunately, in the reality is that we deal with these things as they come. Sometimes you go, your whole family doesn't have any cancer
mm,
whatsoever, whether it's lung or prostate or whatever
mm,
it is, and you just be the first one to develop it. I must also say things like obesity, weight, and
mm.
the diet that you eat have actually been fingered in development of some of these cancers, prostate, including specifically prostate in this instance,
Okay.
and breast cancer actually. So how you eat, whatever you eat, can affect the way your genes work, and then it makes them unstable, and then you develop cancer as a result.
So we need to exercise.
Exercise, correct food,
Mm.
yes, that's the way to go.
Go na le dijo tse di contributang ga cancer.
Um, well, I've read this from the extremist literature. When I say extremists, as people who say, "Do not eat that. Do not
Mm,
eat this," which sometimes is not necessarily always true. So they say that certain food, especially processed foods, cause you to have cancer. However, not everybody that eats processed food will develop
it's like
cancer.
smoking.
Yeah, exactly. So that's a difficulty about this thing as
Mm,
well, is that you have to have a certain predisposition within your genes. That's the main
mm,
thing that stands out. If you don't have it, you can smoke, you can drink, you can do everything in life,
mm,
and you'll still be fine.
The danger is that you can never know.
Yeah, absolutely. That's the thing. That's why I was referring to this movie. That in the movie they will check when you are born,
Mm,
and in fact, in that movie I forgot the name now. They will throw away. They will disguise you as the person who's got lots of problems, and those ones who are perfect, they will let them continue, give them nice life and whatnot because they are They are
Mm,
like that. So yes, you'll never know. There's
mm.
no way of
You can't
knowing.
risk it.
Yeah, so you can't risk it. That's
Mm,
why we advocate for this. And just to finish off the question you asked earlier
mm,
about the prostate cancer, how do you know?
mm,
The also other way we find out is that um, once you are at the right age or having the right risk, we do a test. There's three ways of finding out. We do a test called prostate antigen test, which is PSA. We draw a blood test. We check the levels. The levels should be within normal limits. Your doctor will always discuss those things with you and tell you whether you fall within normal limits or you're outside. And another way is digital rectal examination, where the doctor will pass the finger through your rectum and feel the prostate. It's the closest place, by the way, to feel whether it's still within normal limits. It's the sizes are correct. Whether the one is two lobes, so the one lobe is not bigger than the other. We want to make sure that you always it's always smooth to touch. It's always equal size. It's not sensitive as well, and things like that. And then lastly, they if they find that these two tests are abnormal, they do a biopsy where they take a sample of the space of the prostate, send it to the lab, and the answers will tell you indeed if it's cancer. And once they found that, the way forward will be to get rid of it. And getting rid of it these days, it's getting better and better each time. In private, I know they've introduced robotic surgery, which is something that the first worlds have had for some time. We are also having it locally as well, where they can take it out. People, men are always scared of this, and this is one of the other problems that you mentioned, that men are the last
mm.
ones to go to the doctor. Once they fidget with your prostate, it also affects your abilities for things like erection, ejaculation, things like that. As you can imagine, I already mentioned that it is connected to your testicles, and your same semen and all of that are produced there. So, and another thing is you may experience things like incontinence, where you just pass urine without being in control of it. So that's one of the problems men are worried of. But with an advancement in technology, there's robotic surgeries that can take that item only out and with accurate precision, and without giving you these unwanted side effects that go with it. Although it's still something that is new to the country, but
I'm sure it's pricey.
it is
Mm,
it's very pricey. I tell you
mm.
that.
Hey, let's go back a little bit.
Yeah.
Uh, so so when we Kenya ka yela ya go tsentsha monwana.
Okay.
So you wanna put your finger behind ka
Well,
mo kuzozong.
Gamoxazone, that's right. Ntho tse re di etsang as doctors di ngata. I mean, it is a human body. We need to be able to access it anywhere. So that's one of those. Yes. Kenya exhaust, the finger in the exhaust.
How many men have you done this year, Phil? Ba ba dumetseng gore wena like I'm curious.
Okay, let me tell you,
Mm,
uh, uh, not the right thing, but I also don't like doing it.
okay,
Yeah.
but
So as a result, and for this one reason, let me tell you this something I read.
yeah,
Actually, it was also all over the newspapers.
okay.
Some guy went to the doctor and had the same examination done on him. The doctor needed to do the digital rectal exam, and then upon doing it, because it's a sensitive organ, this prostate,
Mm.
it caused the man to ejaculate. Yeah? The man was so embarrassed. The man was so embarrassed, was so angry as well because he thought he was being molested.
How?
And he went home, fetched his gun, and came back and shot dead the doctor.
Oh no! Oh no!
So, for that reason, it's not a test that you want, and you have to explain, of course, to the patient, but you don't want to do it. The patients must know we don't like doing it, but we must do it, especially if there's a reason to do it. So, to come back to answer your question, how many times have I done it? I do it last, really. If I must do it, I will do it last.
Hey.
When there's now a ultrasound that we can use these days
Oh.
that can help us see the size and irregularities and all of that stuff, and other more advanced tests that we can do without really being that invasive. So I try to use those where as best as I can.
Eish. I'm thinking
And
about
that's just me.
KCM Taco. Lord, Taco Ndieng. But maybe you didn't explain it to him first.
But look, for you to remove your pants and underwear, kicking him to begin with, you should know something. You should know I'm looking for something. I get. O ka se tlobole fela hore, "Ah, hurry." I get. So he knew this, but he probably thought, oh, this one went above board. And then was like, nah, one trial.
Eish, eish.
Yeah.
Yeah,
But
I can imagine. Unfortunately, we now lost the doctor because of the misunderstanding.
yeah, yeah, sadly.
Born,
Hmm.
brother T, tell me, in the black society, especially in the townships,
Mm-hmm.
I'm sure you'll understand because guys.
Hmm.
There's constantly, more name, time and again, where there are only men. You'll find men talking about consumables that they can take, to better their activity in bed.
Mm-hmm.
There's also the traditional ones you find, the herbs. I'll call them herbs
Mm-hmm.
for lack of a better name.
Mpeso, to be
Yes.
yeah.
Your peso is and did you buy?
Hmm.
So are there any side effects towards these things or any medical side effects that you know about?
Just 2 days ago, 2 to 3 days ago, I had a patient who had just used those things, and uh, the biggest side effect is that you have an erection that doesn't want to go away. And it's painful now when it's at that stage, because what happens in your penis is that you get blood going in, because that's what that thing does, but it restricts going out. Now you have this huge buildup of blood inside the penis, which is what causes the erection. The tissue that makes up erection is that if it fills with blood, it becomes hard, which is what you see as an erection. Now that tissue, when it's swollen for too long, it becomes very painful. It becomes uncomfortable. In my experience, in the hospital, I've had to deal with one guy where I've had to actually drain physically that blood out so that he can get relief. There's other tablets, there's other medication, but it's not as effective as actual manual drainage. So um, this guy came in and he had that, which is called priapism. It's one of the biggest side effects. Headache is the other one. As you can imagine, it fidgets around with the circulation, how you vasodilate or vasoconstrict, and so that can also cause some similar effect in the head, and people can have all sorts of problems. And well, look, I must actually say something. Maybe it will help somebody out there. There's this common belief within many in the circles that you are referring to
Mm.
that kunalento some premature ejaculation.
Yes.
Now, this is a big issue over my whole years of work. I've come across that people think just because you went in 2 seconds later you are done,
Mm.
it's a problem.
Mm.
By definition,
Mhm.
uh, you are as long as you're able to go in,
Mm.
and even whether it's one or two thrusts and then you're done,
Mm.
it's you've had normal intercourse by definition.
Really?
There's no medical problem with it.
There's nothing wrong.
Yeah, there's nothing wrong with you.
Okay.
So when women call you 2 minutes or two needle, whatever they call you,
Mm.
as long as were there even for 1 second, you are normal. Premature
Oh,
means
guys, this is very important. Listen to the doctor. Someone who went to school for these things. You know, Bratao, a lot of men are banna bana le pressure e unnecessary.
Hmm,
And I believe it's because of what women say.
yes.
Um, uh, and they normally say it "Ngabashiji bayilwa." When
Hmm,
things are smooth, they're running fine in the relationship. They
hmm.
don't say it.
No.
Ele
Hmm,
qabana and then diacho.
hmm.
Okay, sorry. I'm sorry, but please carry on. So it's normal.
It's normal.
Mm,
So premature means, because we have seen this condition
mm,
just before you get in,
mm.
you're already out.
Oh.
That's the one that's the one that is medically important to me, that I can treat and refer you if necessary.
Oh.
Anything else, that one I just mentioned, it's that where this there was a lot of studies were done around this, and I had a privilege by being taught by a professor in sexology as well
Mm.
at university, and the guy told us, sorry, you anything above 10 minutes, it's unnecessary.
Okay.
Yeah, people want to go for 45 minutes, want to go for an hour, want to go for the whole day. It's not
Now
necessary.
that's abnormal.
Yeah, that's abnormal. But this is what makes gives these guys pressure to go and want to take things so that they
Mm,
can
mm,
show force.
mm,
No, you will end up o ikgobaditse le wena ka tsona dilo tseo. Because some of them, especially the herbal ones, which are not properly
mm,
checked, they
mm,
can damage your kidneys and liver and stuff like that. And then,
mm,
or they can create level of dependency, and then you cannot work without them anymore.
mm. It's better to just exercise and eat healthy food.
Absolutely, exercise, eating healthy, solely fruits and vegetables.
Mm.
That's all you need.
And reduce your sugar intake.
Absolutely.
Okay. Hey, I'm glad I brought you here. You're unpacking very sensitive stuff here. Yet,
Right.
good information to our brothers out there. Okay. No, I see. All right. Look. So, Verity, now there's a young man. Are you saying something at the age of 40? If you are very unlucky, you can start having issues between the age from the age of 40 upwards. Commonly from the age of 50 to going up.
Yeah. So that 40 years, it's usually for the people who have got a predisposition or
Yes. Mm,
family members that may have a similar problem, a
mm,
prostate cancer. So
mm,
we need to start screening you earlier because we know evidence has it that you will develop your cancer earlier than 50.
mm,
Generally speaking, all male we start screening from the ages of 50. That's when you
mm.
are at a high risk of developing cancer. And let me just add this as well while I'm at it. And this is prostate cancer we're talking about. You start from the ages of 50. All of us have a time clock of 50 years,
Mm.
and we have a 50% chance of having prostate cancer. Yeah? And that risk increases by 1% every year. This means by the age we become 100 years, all of us would have had prostate cancer
Automatical.
automatically because that risk increases by 1%. By 60, you're already sitting at 60%, by 70, 70, and so on. So
Mm.
if you don't have it at 90, you are that 10%, but you've got about another 10 years before you can develop your own share.
So what you're saying is that and like a go kgonega gore you are 100 to cancer.
Literature says that I've
Mm,
seen people living beyond 100. I'm not sure because we don't know always about their medical history.
mm,
I'm not sure if they've heard it or not, but
mm,
literature says that your risk increased by 1% from 50% from 50 years of age.
mm.
That's a simple, I think, equation to remember.
Mara, have do you have cases where you've treated cancer ka moo banneng a fola motho permanently and he's never had to come back again?
So, it's a yes and no again.
Mm,
So the cancer is a very nasty thing. I must just say this. It's sometimes you can think you got rid of it and it's gone, and you are happy and you're celebrating. We do cancer surveillance when we have found it and it's no longer there. We've taken it out through surgery or whatever other means, and we need to continuously survey and make sure that it doesn't come back. And some people later on, sadly, it does come back. So you would think for the next 10 years after we picked it up and removed it that you don't have cancer, and we are celebrating all those 10 years, and then later on it comes back again. As I said, predisposition to cancer or to, with these genes that in their memory they have the cancer somewhere, and so they may, or maybe they remove the tissue, because what we tend to do is they remove all the tissue, all of it, just about 100% of it, that was cancerous or that threatened to be cancerous. For some reason or another, you develop something out of nothing, and then you start showing signs of cancer again. So it's a difficult thing to treat, and it's also a very expensive thing, as you can imagine. We have to do this all sorts of tests all the time to make sure that we screen properly, because sometimes you're looking in one place, it's growing in another place.
mm,
So the body, um, I mean, my experience is that a lot of time, most cancers they come up, and then we treat them, and we just have to keep them suppressed. Sometimes we keep them suppressed with chemotherapy. You'll find people telling you that. They've been to a first session this month, and 6 months later they go again, and then 2 years later they must go come back to do sessions and so on, so that they can keep it suppressed.
Mm.
And when they check, they say there is nothing, but they still have to take chemo to keep it suppressed. And if they don't do that, it 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 boils out of control.
All right. Look, if it was up to me, we'd sit here the whole day because we have a lot of information to unpack. And we could talk about any other thing that is health related.
Mm.
But I think we'll cut it here for now. We'll continue again on I think I should invite you more often
Um,
because you've got a lot to share with our viewers and a lot of wisdom. Kind of how long have you been practicing?
wow. I qualified in 2008,
Okay.
so I've been practicing ever since.
Oh, okay. Wow, that's great. You are an inspiration to a lot of young people around because you've been here for a while. You are one of us now in Palaver,
Absolutely.
and sitting with you here, it's also just to encourage young people that it's also possible to be born from a township and end up becoming a medical
Yes.
doctor.
Yes.
There's nothing wrong with where you are born.
Mm.
That is one of our reasons we are doing that podcast to give people information. Not only gossip.
Mm.
In fact, we don't do gossip,
Mm.
but we try and want to celebrate our people and identify people that are making a difference in our society, and we celebrate them. This is also one of the reasons you are sitting with you here. It's because we appreciate you as Palabora, Palabora Podcast Corner. We want to thank you so much. You're doing a great job. A lot of people are talking about your work and how you treat people. Thank you so much. Um,
Thank you for having me.
how do people get hold of Dr. Motsoane? Please tell our people. Here's a camera. Tell them where do they come for consultation? How do they make appointments? How do they get hold of you?
Right. Remove Palabora, go Park Street, number 33 Park Street. Um, number phone ya rona ke 015 781 0340. 781 0340. Sometimes it can get really busy, so you can try 0593. 0593 is the alternate number. And then we're having Facebook presence as well. Just look for Marula Med and you'll find us there. And yeah, I think that's how you can get hold of us. Our practice runs 24 hours. We also have interest in emergency medicine. So all the cases that bother you or things that happen, whether it's a spider bite, mosquito bite, or snake bite, we do that around here. And yeah, I think that's us in a nutshell.
Before I close, let's talk a little bit about Pink Ribbon Walk.
Okay.
What is it about? What's happening?
Oh, yes. Earlier on, when we started, I mentioned that this month in particular, the world in general puts a spotlight on breast cancer. So we saw, or we all we're doing is treating people with problems, but we don't like problems as well. So the good thing is to go out to people and tell them and have an activity where people are all involved in a fun way and to shine a spotlight also on this thing locally because these people all around the world they're doing something. So and there was nothing like a similar hit done here in town. So what we do we come together, we bring everybody that's interested, and they dress up as much as fun as they want, looking pink to acknowledge the breast cancer. And because we also do it right at the end of the month, we also include a bit of the prostate cancer. So we shine a spotlight on both prostate cancer and breast cancer. So on the 26th of this month, this year, we are doing a fun walk where we people walk around the town dressed in their fancy colors. And on the day, we give prizes to the lucky people and the best dressed people. And yeah, it's a fun day really for the whole family from the ages of zero all the way to wherever you can take it. And people usually come in their numbers, and people under the ages of 12 years, we always ask them to come for free to have fun with their family. And the people above the ages of 12, we ask them to contribute 50 Rand, which we donate towards the cancer initiatives. There's a number of NPOs that are doing that are supporting or helping people with living with cancer. So we raise funds for that cause, and we also encourage people to do early registration because it gets really hectic on the day. And if they register late, we've topped it up, or they will donate more money by extra 20 rand for this year. So yeah, that's Pink Ribbon in a nutshell.
Great. I believe we are part of that work as the Palavra Podcast Corner.
Yes, thank
We'll
you.
be there. We'll be there together with my team, Photo of Larry. We'll be just having a good time there. I can't wait to see how Mr. Scholar will be looking on that particular day.
Please dress up. We even if we have a spray for the hair,
Yeah.
so if you must come and just be as colorful as you can get.
Yes.
Some people even cut their hair on the day, just in honor of those that are on chemotherapy, that they can't have natural hair because the treatment takes it.
Mm.
So yeah,
Okay.
you're welcome to come and dress up.
I'm looking forward to that particular day. I'm definitely go. We are coming. It's going to be great. We're bringing our cameras.
Well,
We
you're
want to
welcome.
celebrate this thing with you because you are making a difference.
Thank
Um,
you.
Thank you so much for coming, Dr. Motsoane. Until we meet again on our next episode with you, there's a lot I want us to talk about. Mara, we'll prepare you off the camera.
Yeah. Yes, please.
Great. Thank you so much, people, for watching. Please do not forget to like, comment, and subscribe to our YouTube channel, Palavra Podcast Corner. On Facebook, we are Palavra Podcast Corner. Thank you so much for watching. If there's any other comment or question that you'd really want to ask our doctor, please go to the comment section right there, write whatever it is that you need to know that is related to cancer or this walk. I'll allow you to ask anything related to the cancer or the walk, and then Dr. Mtswane will answer. Please, you must answer on the comment section. I'll make sure you are aware of it so that you can
Thank you.
answer there. If it was not medical questions, I beg you what saying, "Kara, don't worry, it's 1, 2, 3." So ish.
Bazame, who knows?
Yeah, 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 I don't want to be
We
arrested.
already have one such person, Kwako Jube, kwa Mupula.
Ay, yay. Hey, hey, ndizotrenda. Yay. Thank you so much for watching. Let us meet again on our next episode. Thank you. Bye.